Yes, ma'am. Yes, ma'am.
Yeah.
Okay, ma'am. A very good morning to everyone. A life of joy and happiness is possible only on the basis of knowledge and science. Dr. Sarvepalli Radhakrishnan. This is Rajakumari, Assistant Professor, Department of Bioengineering, VISTAS. I welcome all the participants, faculties, students, research scholars who have joined for this international webinar on diagnostic and screening techniques for COVID-19. I would like to thank the management of VISTAS for their continuous support to organize this webinar even during this pandemic time. I welcome Dr. Ian Ganesh, Sir, Dean of Engineering and Chief Guest of today's event, Dr. A.R. Jayakumar, Scientist, Obstetrics and Gynecology, University of Miami School of Medicine. India is facing the second wave of COVID-19 pandemic, which was characterized by increased number of infections and related deaths. Since the beginning of this pandemic, immense efforts have been made for the development of effective diagnostic strategies which may be used to accurately identify the COVID-19 infected patients, thus limiting the risk of contagious and promptly treating any respiratory symptoms, avoiding serious consequences for individuals. At present, several diagnostic methods have been approved by regulatory agencies worldwide. However, there is still considerable need for genetic tests to be used based on the patient's medical history or the investigation purpose. By the end of this webinar, we will get all information about these diagnostic and screening techniques for COVID-19. I welcome all the participants once again. Now, I request Dr. P. Brinda Devi ma'am, Head of the Department, Department of Bioengineering, VISTAS, to deliver welcome address. Over to you,
So
ma'am.
good morning. Yeah, thank you, Raji. So good morning to one and all present here. First of all, I would like to thank each and everyone for joining the one-day international webinar on diagnostic and screening techniques for COVID-19, which is being organized by our Department of Bioengineering and the School of Engineering. I welcome our Dean, Dr. Ian Ganesh sir, and our chief guest of today's webinar, Dr. A.R. Jayakumar sir, for accepting our invitation and provide us the talk in our convenient schedules. I am more confident that this webinar will address the full aspects of the current scenario. I wish this conference enlightens all of us and provide us the approaches to deal with the problems of tomorrow. I once again welcome you all for this webinar. Stay safe and get connected. Thank you, everyone.
Thank you, ma'am. Now I request Dr. Ian Ganesh sir, Dean of Engineering, to give presidential address. Over to you, sir.
Good morning. Is it able to hear?
Yes, sir. Yes, sir.
Uh, Really a warm welcome to our speakers of A.R. Jayakumar sir, scientist, obstetricians and gynecology from the University of Miami School of Medicine. So, as the Director, Associate Professor of Neuropathology Research, Miami. I will giving a wonderful talk on this diagnostic and screening methods for the COVID. So, essentially, present scenario. And before handing over to just a couple of minutes, I want to talk about this diagnostics as well as the screening test. We know screening test is a preventive measure to detect a health problem or there is a disease. The main purpose it is to early detection, help to reduce the risk early enough to treat most effectively for this COVID scenario. Whereas in the diagnostics, as per according to me, there is a slight difference. I may be right. And screening detect as well as monitor the diseases, particularly monitor the diseases. And so much advanced methods are here in the technology are available now. And aware how the results of this diagnostic testing will affect or determine the probability of the presence of the disease on the patients. And the second point, very important point, which both the diagnostics and screening give the nature of the disease identification and particularly the conclusion, such that what the type of started by the results of this diagnosis. Whereas there is a clear disadvantage here. The case control design, particularly, it is available in the advanced countries. It is available in India also, but we are not clear that the sampling and other techniques, other methods, for example, maybe clear or unclear methods, or tools which can be used for effective diagnosis is effective. It is not more than 90 or 100%. We are just lagging in that one, but more tools are available, technology available, and in future I am sure that for example, I can tell you within 1.5 years we have found a particular vaccination COVID-19 effective to 70 to 80%. So much advancement when you compare 100 years before. Now the medical technology has improved much more, and decision from this test definitely gives much more accuracy now and also in future. So nowadays, the present scenario as well as in future, the biotechnologists, bioengineering people are essential now. More number of unknown viruses and a lot of efforts are needed to get the vaccination, to know about that behavior. And this scenario, that is this COVID-19 scenario, second wave, how India got affected much more comparing to other countries. So this topic is definitely essential for our students, for us. And I congratulate the Department of Bioengineering to take this effort and call the international and arranging these international webinars, particularly conducting this. Much more webinar like this would be helpful for our students. Again, thank you very much, and congratulations to the Bioengineering Department, and all the best to all the students who are participating here. Thank you very much.
Thank you, sir. Now I call Ms. Tiruchelvi ma'am to introduce our chief guest.
Good morning, everyone. It is my privilege to introduce our chief guest, Dr. A.R. Jayakumar, sir, scientist, University of Miami, School of Medicine. He completed his PhD in physiology and pharmacology interdisciplinary in India. He is specialized in neuroimmunology and neuropharmacology. And he did his postdoctoral fellowship with Dr. Michael D. Norenberg, a well-known neuropathologist and who is specialized in neuromedicine and neuropathology. He worked as assistant and associate professor in collaboration with his colleague, Nobel laureate Andrew V. Scally, who invented the hormone. And currently he is working with him on cancer and rare diseases. He has published over 100 research articles in high-impact journals, and he is a highly cited researcher in neurosciences. He evaluated more than 80 PhD theses around the world, and he also worked as a senior and section editor in 7 international journals. He has also involved in the editorial board member in more than 12 international journals, and he also have a high impact journals and foundation and federal grants. Apart from this, he is a member as well as chair in various committees. He has trained more than 50 medical students and faculties from various universities, countries, including Europe, Asia, North and South America. Currently, he is teaching for MD students, residents, fellows, and training faculties. He has more than 25 years of experience in neuroscience research. So he is considered as one of the top researchers in the field of hepatic encephalopathy and chronic traumatic encephalopathy. Actively, he is involved in clinical, experimental, and translational COVID-19 research. Currently, he is performing research on rare neurological conditions such as SARS infection, skeletal dysphalia, preterm birth, fetal and neonatal hypoxic brain injury. So it is a privilege to have you as a speaker, sir. I welcome you, sir.
Thank you so much for everyone. Particularly the Dean, Tiruchelvi, of course, and the head of the department, and whoever introduced Rajakumari. I thank you, everyone, including the visitors who are interested to listen the talk. First, briefly, about why I came here, and this may be very important for you in the future, not only now. So I have been working what Trichelvi said for many years, more than 25 years. Of course, I came to US straight to Miami 22 years ago. Then I have been working in many things, but in the same lab for the past 22 years. Mostly working on brain, but I also go around and look other things because my colleagues around me, they were asking help, this and that. So I was working some cancer research. I was working something other, some other parts of the body, some other diseases, other things. Apart from, I have another area to move forward, that is traumatic brain injury, that I have been working for more than 15 years. So this I came because of two major reasons why I came to this area specifically. This I came like a year and a half and 2 years ago. So I briefly explain what happened and why I came to this. Number one reason, very closely related to this, is last year there was a Nobel Prize, you might know who got it. The guy, he's my colleague actually, he got Nobel Prize because he was using a virus called hepatitis virus to induce infection in animal model. But what happened to me, I used some chemical to injure liver, and I was studying the brain and other parts. So we both were published in the same journal with subsequent papers, but he was awarded and I was not awarded last year. But my work was discussed because the award going to a specific person. So I lost with a movement because the virus is so close to what they were looking, I mean the Nobel Committee. So they gave the award to him. So I was so disappointed. Number two reason, these are all very important for you, not only for the people here or there and everyone to learn. So this has happened as an incident in 2019 December. So I have some limitation to explain everything, but I can tell indirectly few things before I go into the talk. So 2019, someone came from another country, and that time there was some incident, like some people experienced some virus, like hundreds of people, and then with those hundreds of people, about a quarter people, like 25, are died. So some people came from that place to my department. So he flew all the way down, and when he came to the lab, what happened? He touched my door. He shouldn't touch the door because he don't have a pass to enter the building. So what happened? Somehow the door was that day didn't operated or something happened, but this guy came inside. When I saw the guy, he was not normal. Then I saw him a year ago because he was a faculty along with me in my adjacent room, but with other people, and he got a better position in his country. So he went to his country, and he come frequently to see his wife, who was working close to my laboratory. So what happened when he enter, he touched the lab. I said he touched the handle of the door, and he came inside. And I didn't feel comfortable because sometimes you don't know what happened. The virus spread more or less, or it's going to be severe or non-severe and rapid. It's very difficult to predict what will happen with the virus. So immediately what happened, I went to the director office, and then I was telling them, hey, in this country, there are some things going on, and there are virus, and people are coming. So we don't know whether they are bringing the virus or not, and the person look like not normal. So you may need to think about, and you need a protection. So then I came home, and I was normal, nothing happened. And then the next day I went to work, and everything was normal. And I see him far away, like 20, 30 feet away. And then I say hi, but I didn't talk to him much. I try to avoid because I know the problems from the, other viruses. So what happened in the following day, exactly on third day, I was sick. I was not able to breathe actually. So that day I quickly identified that I got the virus from him because I touched the same handle. And even though because of some hurriness, I didn't clean my hand. I was running so fast to take my car and do something. So I don't know what hurry that day I had actually opportunity. So I left, and then, I didn't bother about that. But somehow I touched the handle, it reached me. So when I came home, I called my brother in India, and then I was talking to him. He said, I never seen you coughing like this in your life. So what's going on? When he was asking, I was not able to breathe. I was not able to talk, all those things. So I thought, okay, go ahead and take some tea so the tea might reduce. And after that, I can go to the department and take some medicine, and I can be normalized. But that's not the case. I was not able to move from my bed. So it was heavy pain in my body, and the basic problem, I was not able to breathe. So I stayed and I called everyone in the laboratory because I have my associates and technicians, everyone. I called them and I said, I may not be able to come. So then what happened, in the next day, my wife got it. So she got exactly the same, but it disappeared within 24 hours for her. But for me, it went a couple of days, and then I was normal. So then I predicted correctly the day. This is exactly 2019 November, end of November and starting December. So the two people, I have two babies, and luckily they were sleeping with my wife, but they didn't get the sickness. Only we two got the sickness, and we came to normal. So this happened like 5 days. 5 days later, I came to know that several thousand people got the sickness in that country, and a lot of people were dying. So every day by day is increasing number there, and suddenly see the incidents in US. There are a lot of people was infected, and a lot of people dying. So what happened? Those people from that country, they flown quickly to New York. A lot of people, they didn't even tell what's going on there. So they jumped quickly to New York, and whoever entered the New York airport, they spread it everywhere. The mess everywhere, the mess, and the virus spread all over. So I live in Miami, so you guys might know how the Miami beach is and how the Miami crowd is. It's a beautiful city and beautiful place, but there are a lot of crowd in the beach, this and that. So a lot of the Miami is the targeted place that time in the whole world. So these people spread it everywhere because all Europeans come Miami and stay here for a long time, and they do all the mess. So there's a lot of virus. So I honestly escaped from that incident. But I know that I got the virus, and then I was normal. So I'm very sure that time that I don't have the flu, because I took flu vaccine a month ago from that incident, exactly a month ago. So it's definitely not because of the flu vaccine which I took or something else. So this is the story why I was interested to check what's going on. But now I'm moving a little forward to see, where to go and how to go and what to do. The main reason, I lost some of my family members. So until yesterday, someone died in my family until yesterday. So this is a bad situation I'm hearing there. I understand, everyone how psychologically affected and what the problem is going, but we all has to be united and take care these conditions. And there are another reason that, the biggest reason is, our place is a lot of things. There's so many. I don't want to bring this one, but there are so many things. But number one is the major issue is we don't have that much efficiency to predict the things. That's very, very important why we got this problem into this level and what we needed. So there's a lot of other things because we are looking not only, here, we are looking around the world, what's going on, how people are taking care, and how the politics and other things, we have to see everything. So I am very sure that if you take the vaccine, I'm very sure that you will be protected some aspect. Doesn't matter if you take 1 or 2 or whatever the cases. Please, I ask everyone to go for a vaccine. Please take a vaccine that will protect you. Definitely. Thank you so much for taking this time. So now I request to show the slide that I will present some of the techniques what we are doing. So what are this one I accepted when Tiruchelvi asking me to present something, because my wife has her own company to detect the virus, and I am working currently on the virus. So I'm having like so many samples, human samples, and I have so many experimental animal studies going on with the virus. I will be showing some of that in the slide at the end. That's the reason I have the conflict. So this will be definitely helpful for you or someone who are interested to do some business even too. So you can start your some kind of detecting places, and you can do the things, and you can serve the people. That's the basic here. So it will be very useful. I have a lot of information here that you may not be able to get it from our place because it's not available in any kind of media or anything. So this will be very useful for you. I thank you for the passion to see my talk. So could you please show the first page? I don't have anything. That's me. That's the title you gave me. The second page, I'm showing this because someone, I humbly request you all not to take any of the portions, because I submitted many patents, and there are many patents, and there are other steps which I'm publishing, submitting grants, this and that. There are so many information here. So it is better for you not to copy anything, and so that might affect in many aspects, particularly the person who are organizing the meeting. So I kindly request don't do anything. If you need some information, of course you can reach me. I didn't have, I guess I didn't have my email or something, but you can find it my publications. If you go to PubMed or something, you can see all my details, or other professional societies like ResearchGate or LinkedIn. You may be able to see completely my information, but definitely I'm sure I will provide you all my information. Another point is I'm ready to assist you, whoever interested to do something, whatever aspect you need to do. You want to do some research, you want to learn something, or you want to assist something, whatever you needed, I'm free and I'm here to assist you in any aspect, and no problem. So that's my first slide. Tiruchelvi, can I control or you have to control?
They
Hello?
will control, sir.
Yeah, go to the next slide, please.
Raji, you
So
can make it
the
into
next slide is
slideshow.
the one
Sir, one
that
second, sir. So 1 second. Raji, you can make it into slideshow, full screen. It's not the full view. You can start from the beginning. The left side icon is there, right? Raji? Sir, you have your PPT, sir? Rajiv? Raji, what happened? Sir, you have your PPT with you?
no.
Sir, I think she has some technical problem with it. Tristan, just please call her. Tristan, you can call her.
Yes, it's coming. Yeah, go to the next page, please. So the next page. Yeah, so that's okay, no problem. The previous slide, basically, I was want to show that, I kindly request to follow the conflict of interest, which I have. That is good for you and me, so that I can be so clean. So briefly, I talk about what is going on in the epidemiology. So I'm not considering what's going on only in the US. Also, because we mainly focus the country here, and we don't look at outside. But so far, there are more than 160 million. That's a huge amount that is not even seen in Second World War or any World War, any other cases. This is the highest death so far, because the Spanish flu, they killed more people, but for the statistics for a long time. But here, this is for a very short period. This much people, we don't know how many people they're going to kill. So this is very tragic. So there are more than 4 million deaths. It's a huge death. And there are every day, as not only in India, everywhere, there are 250,000 people getting into disease every day. That's a really bad situation. So what are the symptoms? So when I give the strategy for the testing, so there are so many other components that you may have to look before the testing. That's the important part here. So that one of the major part is the symptoms. What symptoms you will be considering? In general, these people have a big list ranging from fever, cough, and fatigue, and other problems. I will bring that later. So the one of the major one, the people at the end stage, none of the organ is working. So because I have all the organs right now, for example, to tell, when I cut the lung, I'm not able to cut the lung. For example, if you go to the mutton shop, if you get a mutton, if you cut, how the knife cut, it will be easy. But if you cut a stone, how that is hard. Exactly the same conditions I'm experiencing when I cut the lung or any organs, in particular lung. Then you think about how severe the disease is. That's purely because of the thrombosis that I will bring it later. So the major problem in the disorder is the multi-organ failure. That to lead to the least one, there are some pregnancy complications. I hope you all learned recently from the Indian ICMR news that lot of pregnancy in the Delta virus which you have right now, they affect more on the pregnancy when compared to the original virus. That's something is important to look in the future. So next slide, please. So this is to the overview. What's going on right now? So yeah, slowly. Okay. So before I go into the test, I just want to tell who need the testing. That's very important, for you to learn. So who need the test? Whether they have symptoms or not symptoms, what the conditions are. These are all the important items you see before you go for the testing. So these are all the major testing options for the people who need it. Persons with the signs or symptoms of COVID should have diagnosis, definitely. So what kind of testing and where can be done? There are two sequences. One is a rapid one, another one point of care. So what is the difference between these two? So the rapid care means when you go to if you have a problem, you go to the hospital. I know very well about our place, even though I left 22 years ago, but now there may be better development. I don't know what's going on. But here in the country US, the point care, when you go to the hospital, they take the blood, they test on the spot immediately. So they don't ask you to go to providers. You mean for some test, what they do, they recommend you have to go outside the hospital, and there are a lot of testing centers like Quest, LabCorp, all those centers. that you may not know. So those people take the blood and whatever they needed, and then they send to some other centers where they are testing. So it takes a lot of time consuming. They collect one day, they send another day, and the test take a couple of days, standardization, that. When the result come, you will be very sick and you don't know what you are doing. So the point of care means they do immediately. They take in the hospital, they do immediately. But there are some limitations in the point of care when compared to rapid test which you're sending outside. So the sending outside has more advantages and disadvantages, and the point of care has some advantage and disadvantage. And who has to take what, I will tell later. So, and then the next problem is the selection and interpretation of the results. That's very, very, very important. So when the results come positive, what happened? What does that mean? So negative, what does that mean? Who has positive? Who has negative? These are all the interpretation is very, very, very important in this testing. That's something has to be looked at very closely, that I will tell later on. So this point, the last one is also most important, because someone will get a confusion. So I took vaccine. So when you do the test, whether they're going to show positive or negative, so they wonder, but not. The taking vaccine is not going to affect anything of your test, unless if your test is going to be like a serological, they call antibody testing, that I will show later. So that one can influence, but in the other testings that won't show or interpret with the results which you have prior vaccination. Next slide, please. So these are all something you know before you go to test. That's why I'm giving some introduction so that you feel, so why we need a test and who need the test. That's the basic. Next slide, please. Hello? Yeah, okay. I skip, that's okay, you can keep it there, no problem. Okay, I will give you a brief introduction. So the testing is why they need the test and who need the test. So the test is to control major part. This is not for first treatment or anything. First, you have to control spreading the virus to other people. That's the major part. So you have to concentrate people who have symptom in the first stage, and then you have to go for non-symptomatic people to see whether they have the virus or not, because the non-symptomatic is one of the worst cases, because you don't see anything, but they spread the virus everywhere and other people get the virus. And that's very, very important thing. So what is your major aspect to look someone to test? So this is to prevent it spreading that one. So there are so many strategies they do. Diagnose the infection or screen or reduce asymptomatic to pre-symptomatic transmission and monitor trends of infection and how much the infection is, and whether it is increasing or decreasing, whether they're going to asymptomatic to symptomatic or symptomatic to asymptomatic. All those things can be learned. So for that purposes, you definitely need testing, even whether they have some other viral infection or something. So you have to look for people in the first step who has symptoms, and then you go to asymptomatic people to see what is going on. So the next one is the equity. You have to see like healthy equity and testing, and choosing a test, what kind of test you have to choose, and then how to interpret, as I said. So whether the vaccinated people, non-vaccinated people, all the complications, you have to look before you go into the testing. So that's what the talk, this presentation I prepared, mainly who need the test and what test is needed. So the next page, please. Yeah, could you please change the next page?
Next slide, next slide, next slide. Raji, you can change to next slide.
Oh, I can change, okay.
No, sir, you can't change. No, you can't change.
Yeah, I cannot change because you guys.
Yeah, they are straight. Raji, you can change to the next screen.
Okay.
Yes, sir.
So this is to how much time these tests take. Before we go to the test, that I brief to how much time they take. The rapid, there are some tests which we are, yeah, the previous one.
So sorry for the inconvenience, sir. Just wait for 2 minutes, sir. I think they have some issue with the PowerPoint. I will just start it out.
Yeah, wonderful. Yeah, good pass. This works better actually. Yes, very good. Go to next. I think this is this work a little speeder than the previous one. Yes. Go next. Go next. Okay. So okay, here this is a place. Okay. So now I'm coming to this slide. Actually, basically, I'm trying to show how the vaccination going to interfere with the SARS-CoV-2 testing. But what are the tests right now available? So here I'm showing, there if you have prior vaccination, it's not going to affect unless if you use antibody testing. So right now, majority of the tests use RNA, not the antibody, but both the tests are available because the RNA test is a little expensive that I will be showing all those details later on. Expensive compared to the antibody test. So here in US, you all know that we have two major vaccines. One is Pfizer, other one is Moderna, and Johnson and Johnson also coming slowly. But these two, they use spike protein. So I hope you might know a little bit about the virus. I have a picture later on, but here I have to introduce you before I go to the picture. We use those tests use spike protein to test what are the positivity coming out when compared to the serologic test. The serologic test is like the two of them, like IgM and IgG. So they are antibody testing. But the issue here is the RNA test is more accurate than when compared to antibody test. Why antibody test is not accurate? Because if you add infection earlier, your body raised the antibody, and later on when you test, if you see the antibody, that doesn't mean that you have a virus. The virus all gone, but the antibodies is in your body, and the test will not tell whether you have the virus or not virus. So this is a very indirect one. Then you have to go back and compare it with the other test what is available. So I will be going to showing those tests later on. So go to the next slide. So there are some proteins are there. I can show you later. Yeah, I think I went over. Next one. Yeah, okay, stop here. So this is one of the important slide here. So the first one, there are two major tests actually. This is very standard. There are two major tests right now is going on. There are so many other tests that I will be showing, but the two major is the standard test. The one is called NAT test, that's nucleic acid amplification test, which measure, as I said, the RNA. And the other one is antigen test, which is a immunoassay. I said that is detecting the antibody. So what the NAT test shows that you can use RT-PCR. They call a reverse transcription. You all know that RT-PCR, there's a technique to see the RNA component of the cell, anything or virus or any pathogen or organisms. And this test is highly sensitive. So right now, most of the labs, they use the test here. I don't know what's going on in India. If I remember, until last month, we were using like an antibody test mostly because of the cost effectiveness. And then there are other positivities and quick and all those things. But this one, the NAT test, the RNA test will show very specific, and you will save time, accuracy, and then you don't need another test to confirm. This also high specificity test, as I said, compared to the antigen test. So what it really is detecting? So one or more. It's not just one simple RNA. So the virus has so many RNA, like I will show those proteins. So the proteins and RNA, it detect, you can choose any viral particles, like M protein, S protein, or nucleocapsid protein, or you can use any RNA from that. So that will also tell what is going on right now. If you go to the hospital, if you do that test, that will tell today what happened, but it won't show the previous one or later one because that test antibody. So this is the right now is important, and this test will show correctly. And if you do this one with the proper instrumentation and technology, it will be worthwhile. So what is the time? That's the most important that I mentioned before. How much time you needed to do the test? The NAT test take 1 to 3 days when compared to the antigen test. That antigen test you can do very quickly now. Previously it take like 3 hours, 6 hours, like 4 hours. Now you can do like 15, 20 minutes or 30 minutes like that. So, okay, what is the difference between the NAT test for 1 to 3 days and there is a test for 15 minutes too? As I mentioned that, so if you do point of care means if you go to the hospital has the test, you can do it immediately there. Within 10-15 minutes, you will show the results. Or if you send it to some laboratory, they take 1 to 3 days. As I mentioned earlier, they take outside and then they do all the amplification, they take a lot of time. So it is important. This one clearly says that if you have the NAT test in your hospital, it's very easy to detect and treat them immediately, give them medicine, and you will clear the patient from that area. So here, as I said, see, the antigen test is less sensitive than the NAT. Most can be processed at point care with the results available in minutes. Even you don't need more time. Thus can be used in screening programs to quickly identify those who are likely to be contagious. Because of the performance characteristic and antigens, it may be necessary to confirm, you know, what happens. So even though if you see like a positivity, or if you don't have or negativity, so you have to confirm. That's the major problem with the antigen test. Again, you have to go back to NAT to test to confirm that the finding with the antigen is correct. So instead of doing this multiple times, you just go and do the NAT immediately. That's the recommendation right now. The CDC here, the CDC Center for Disease Control, the authority agency that also provide the decision, you have to do NAT immediately. So don't go for the antigen unless if you need to know whether the patient has already, got the virus or what happened in the future, those kind of things. But these are all for investigational purposes, not for the treatment purposes. Next slide, please. Okay. Yeah, okay. Okay, so that's what I was telling before. The first one involved acute infection. If we have acute viral infection, so detecting your viral component, the NAT is very good. The second type is the serological testing, like immunogenic methods to detect antibodies that the body produce when the body is exposed to virus. They produce the antibody that can be detected by the serological test, but that won't tell whether you have the virus currently or not. So what are the tests available? Now I'm coming to the test. What tests available? There are molecular tests. There are many molecular tests that currently we are using. Particularly, I mentioned that I'm using very advanced test to do human samples called multiplex. I will be showing some of the results later on. And I will also explain how that work and other things. But I don't know whether that going to be feasible. That's very, very important. For example, the instrument which I have, the multiplex system to do the NAT. This is a NAT is a single one RT-PCR, but which I have is more advanced. The instrument itself is like in Indian money 8 crore, and I can. But the good point is I can measure several thousand samples in a day. And it will be so faster. You just insert the sample and in direct and you show you positive or negative immediately. Next slide, please. Okay, so the last point is, I mentioned before, how the correct interpretation, the result the correct interpretation is very, very, very important. What you do, that will complicate many, many things that you will learn from the following slides. Next, please. Okay, so now you're going to choose the patient. Now the patient is coming to the hospital, or someone has a problem in his home. So how to identify who has to be tested? You just cannot take everyone to test, and some people may have some flu virus, some may have some parasitic, some may be fungal. We don't know what kind of infection they have and why they are coming to hospital. But these are all the standard parameters. Currently, the National Institute of Health as well as CDC recommending. If you see these symptoms, don't wait. Just immediately do the test to that person. Doesn't matter what they say. Whether they say I'm okay, not okay, I don't need to test, I don't need the drug, this and that. Don't leave them because he is going to spread the virus everywhere. Just if you see, or if you see near you, then immediately ask them or immediately recommend him to go to the hospital. These are all the symptoms you have to recommend. When you see, you have to go to the hospital, like a fever, cough, shortness of breath, taste and smell. That's the number one. Immediately you can identify yourself. When you eat food, the tongue won't work properly. So you see the thickness and all those complications. And you will see body ache and muscle pain and all those things. Very frequent headache. That's one of the important indications before the virus start to replicate. That's very, very, very important. Because the inoculation period, they take at least 2 days. In the 2 days, you will see all these changes. It's not going to show after 10 days or 5 days. So when you see severe headache, don't take it easy at this time. You immediately doubt on that one, what kind of a headache you have, and whether you have, taste loss, or you have sore throat, or running nose. I'm not agree with the CDC, because not everyone coming to the hospital, they have running nose or congestion. They look normal. Suddenly they find, suddenly they were not able to breathe, but they vomit. So the last parameter which I have is the diarrhea. So how many people have diarrhea? But for example, if you take vaccine, you will experience diarrhea immediately. That's one of the interesting indications. Because it go and it screw up the GI. I'm sorry. It go gastrointestinal system, and you will get that no one knows what happening, why you get in diarrhea, whether they kill the normal flora and whether they kill the good bacteria. No one knows what's going on with this virus in the intestine right now. But most of the people, they get diarrhea. Depend upon the country. Some country they don't see in many cases. Some country they see cases, and some countries see everyone has a diarrhea. So overall, the diarrhea is one of the major parameter. If you have symptoms, you just go to the hospital. Next slide, please. Okay, so this is a testing tool. So what happened? Even as a engineering people, you may have to consider this part. The biotechnology or engineering you guys do, and you have to consider. You should have a tool to decide who need the test. So these are all the parameters you have to consider. If someone has a close contact with someone in 14 days, who has prior infection, or if you are standing 6 feet close to the person, so for some like 20 minutes or 30 minutes, you are prone to receive those virus. Or someone has in 14 days, they may have at the end, but it is spread to you. And in particular, if you are in indoors, that we have to be very careful. Please avoid any indoor. So, but you should have you can develop a tool and you can send it to the hospitals, or the hospitals who are practicing, they should have a tool to monitor, to decide so what to do and how to manage those things and how to avoid them. So if you have all those symptoms, but I recommend not only the CDC tool, I'm recommending, don't go and test unnecessarily, because when you go there, you're going to pick up virus and all those things. And please don't go if you are normal, but don't bother to go. So I don't think you're going to receive the virus. Next one. I have a lot of steps here. You can read it later, or you can receive this information, and this will be very helpful. Next slide, please. Okay, so here is a major part actually coming here. So what I'm telling in testing? Yeah, next page, please. Yeah. Okay, so here you see what are the component you have to look. You're going opposite. If you cannot go, I can skip. But it's a good slide for you to understand what are the things you needed. Yeah, the previous one. Yeah, please hold it. Oh, yeah, please hold it. Here, see. Yeah, here, see. These are all the major component actually. The nucleic acid protein. This is viral genome. This RNA can be used. There are many assays, but this one of the important one is the FIC assay. The FIC assay will give more accurate results. And this is the important one. Everyone knows the spike glycoprotein. So the spike glycoprotein, when you expose, your body will raise antibodies. There's called neutralizing antibodies, and you can, that can be detected too, apart from the RNA and other things used. But the people use the spike protein to develop vaccine mostly because this is the major protein and that important protein to invert the virus into the cell. And then the M protein called the matrix protein. So this can be detected by NTS, the technologies I show you later on. But this is the most important, the viral RNA, the nucleic acid component of SARS-CoV-2 genes. This is the RD-RP, and then the ORF1AB. These are the two major. This is the enzyme, and this is a RNA enzyme, and this is open reading frame. They call open reading frame OR1AB, the component of the virus. Those are all the RNA people use to detect. They use all the technologies here. I'm going to show you later. One of the major technology right now we use is the PCR. This is a digital PCR that give more accurate measurement when compared to other categories. So the envelope protein also people are using, but this is to, again for confirmatory or to produce some vaccine candidates. That's a major important. These two people are right now using it. So next one. This is to show genomic components. Here, this is the most important slide. You may have to look deeply here. So what are the tests right now here? There are two categories. The first category is nucleic acid amplification technologies. This is a major one we are currently using in US. So the number one is RT-PCR. So what is advantage and what is disadvantage using this? When you use the RT-PCR, you can use and the replicase, RNA replicase, you can use envelope protein, you can use, or nucleic acid protein, the RNA you can use. And the time is only like an hour and a half. It is not taking more than the time. The procedure I will show you later. So what are the disadvantages here? This is high sensitivity, and you can quantitate absolutely, and no contamination issues and other problems. But what are the disadvantages? That you have to weigh from method to method, which is advantage and which one has more advantage, which one has less advantage or disadvantage that you have to look for. So when you do this one, RT-PCR, so this is a relatively high probability of false positive detection. So I hope you will know what false positive detection. So it is not, if it says it's a positive, that's not a positive. That's the problem with this one, the disadvantage. And then the reaction efficiency also affect the test output, whatever the data coming output is, it shows that interfere, the reaction efficiency interfere. But when you go to digital PCR, this is a very good technology right now we have, and the advantage with one, you can do within hour. You can use these proteins like the open reading frame and nucleic acid protein. These can be used, and these are all the component of the virus. You can use with you can detect within 30 minutes. This is high sensitivity and absolute detection. You have no problem. The only problem here, disadvantage, is very expensive to do this test. Very expensive. So, but when you come into countries like for us, like India and the Asian countries or other less income countries, they have to question, so what to do. But we have to somehow to increase the revenue and to do. So I force to follow this technique actually. So if someone there in your place, if someone want to do the test, a more accurate test, so you don't have problem, then go for digital PCR. And then there's a multiplex PCR. There's a the multiplex PCR is I said that's the one right now I'm using in my lab. The problem, okay, they have advantage, disadvantage. The advantage is, so you can do within 2 hours, ability to detect multiple targets. You can do at a time many component of the virus, and then high efficiency. So you can use with the low samples, and you can do many tests in that one. The only problem here, there is some issue with the primer require further optimization. That's why when you use the primer, that you have to confirm the primer is okay. So you have to do another test before you go into that. But if you do, you can do so many tests. I mentioned I did many samples actually. So many, so I cannot tell how many from my hospital. And this test is very good, but time consuming. There are other components are there. So the other one, LAMP test, which is loop mediated isothermal amplification. This test is something, because you guys are engineering, you may need to think about, this is something you can modify the technique. This is very good technique right now we are using. The problem is, so how your sample is more integrated or not. So if your sample is not complicated, then it is easy to. Otherwise, it's very, very hard. And then you have to design the primer carefully. Otherwise, it won't detect anything. So you have to repeat again and again. So there is no much clinical data to come to some conclusion. These are all the disadvantages, but this can be done within 30 minutes. That's one very, very, very important thing. And then the other advantage is, you need very little samples, like what we use in the multiplex PCR. Here, all three, the multiplex, you need only 5 to 10 microliter when compared to other tests which you need 50 microliter to 100 microliter. For that, you have to use a lot of blood to get the serum. You have to take like a 20 ml instead of that 10 ml. If you need only for 5 microliter, you just need for 500 microliter. Very drop. You can prick it from the finger, and you can take and you can spin and use a couple of microliter, and you can detect. So this is very good when you use the multiplex PCR. Next slide, please. These are all the tests right now available. You please note that one, or you can snapshot if you want. So these are all the component with the different countries using. Here I am showing these are all the standardized which is CDC approved. Whatever the CDC approved, not for us. So this is the US. These are all the primers which you use. Here I can show this is from Germany, and this is from Hong Kong, this is from China, and again this is from Germany. The Germany also use M protein, E protein, apart from all other component like the RNA here, other component like non-structural protein 14. So they use many. These are all non-structural proteins. So the NSP 14, all those things that people are using. So these are all to see what are the primer pairs they are using right now to detect the SARS-CoV-2. Next slide, please. So, okay, this is what I said. This is the component, this protein you might seen in many pictures. This is the spike protein you can see here. And there are some membrane protein and envelope protein and nucleocapsid protein. So how big are they? This may be useful for you if you do some some engineering to construct it differently, or you can manipulate those components, and you can study, or you develop your own testing. So this slide will be more useful for you to consider. So next one. As I said, there are more than 24 to right now. We are using like a few 4 to 5, but to confirm you need at least 2 protein. For example, I will show some of the slide later on. For me, I recommend you do the spike protein and nucleocapsid protein. One is from the outside, one from the internal, and you can confirm, okay, this two protein is there. This is SARS-CoV-2. If you see the problem with the spike protein, so I don't know how many are so deep in science, but I just throwing it and you catch it if whatever you want. So the spike protein, that's a glycoprotein. So what happened? Every virus has a glycoprotein. When you use for the RNA for the glycoprotein, it's going to show positive. If you use only one spike protein, some company, for example, if you have a small testing laboratory around your place, if they use only spike protein, if you go and give your blood and you have some virus X, whatever paravirus or Zika virus, whatever the virus you have, is going to detect. Doesn't matter whether you have flu or you have rabies, or doesn't matter what virus you have, it's going to show positivity. But that doesn't mean that you have SARS-CoV-2. So you have to take another protein which that doesn't have in other viruses. For example, nucleocapsid protein. You go for nucleocapsid protein, and for the RNA, you take the RNA and test them. So this is a simple procedure. How you do. So you take the virus, collect the serum, whatever you have, or tissue, whatever you're going to do, and then lyse them. This is the sample. You have the lyse. There are lyse buffers. So when you start the testing site has everything. So now everything is from the company. We don't make anymore in the laboratory. So you have the lysis. Add the lysis buffer, lyse them so that you can get every component, and then purify the RNA. When you lyse, everything will come out, and you have the RNA, and then purify the RNA, and then do reverse transcription into cDNA, and then so you amplify. That's the way when you amplify, you see the results, and see from there, you go and interpret. This is the procedure right now. The NAT, which I mentioned earlier, NAAT, this is what the procedure right now. So you collect the sample, isolate RNA, and do the transcribe, and then amplify, and you will get the data for whatever the cycles you can run, depend upon what the instrument you have. So this is the procedure. You have quickly to read if you want. So usually, where are you getting other than the serum? So we usually take nasal and throat swab from the hospital, and then harvest all the viral particles and the mucosa cells and swab samples, then lyse, then take out extract, and then do the amplification, everything. And then the result will be depend upon the cycle. You get this, the results, and you decide whether positive or negative. That again, I said it's very difficult to interpret the data, that I will tell later. Next slide, please. Okay, so what the other one, before I said the nucleic acid detection, this is that RNA. Now I am showing the immunologic detection. The immunologic detection is not, so it's important, it depend upon what need what purpose you need it. For example, I told you earlier, when you test the immunological test, you do IgG or IgM. So IgG, this is a lot there. So IgM is clearly says that, so you have some pathogen, your body had some kind of pathogen, so you have the antibody in the body. So you have the IgM. So that means you had a problem. So suppose consider that 15 days ago you got the virus. So your body maybe developed the antibody. When you test it today, you have some kind of fever or something. If you test, it show that positive, but that doesn't mean because you have the virus. This fever may be something else. So you cannot come to immediate conclusion that you have the virus. You don't have the virus. You may not have the virus, or you have the virus, you don't know. That's the problem you have with immunological detection. So you have to go back again to the NAT to test whether you have the virus or not. So the RNA, you have to take some of the component RNA from there from the solution or from the sample, and then you have to confirm whether the immunological test which you did is correct. That's the problem you have. But what are the things still? Okay, what happened? When this one help really as I'm I'm a clinician. I'm doing clinical translational research. I'm doing clinical trial. I'm doing basic research. I'm doing advanced technology. So I use a lot of this test for many different purposes. But when you go to the clinic, there is a doubt how much you needed. That the hospital has to decide what you really need to know. For example, if you have the virus, if you for pregnancy, for example, you got the virus when the baby is born. So what happened to the baby? If you come after 2 months later, if the baby, when you do the baby show some positivity. What does that mean? That the virus came, the antibody test you saw, when you do the antibody test in the baby show positivity. Where that antibody came from mom, or she got that after she born. There's so many complications, but there are advantages. When you see the antibody, that will really tell there was some infection period. It may be before or it may be after, but there are some consensus, there are some interpretation, there are some suggestions. The baby doesn't have any viruses, for example, because there's something aside. I don't want to take your time now. So what happened? The baby don't have ACE2 in the nasal because the virus has to go immediately in the nasal, although it has the umbilical cord and other parts of the area, but the amniotic fluid and all those things. So that the amniotic fluid mostly you don't have, because the amniotic fluid is the urine basically, right? So you don't get the virus. So what happened when the baby, that baby doesn't have the ACE2, so the virus won't go into that and infect. But if you detect after 2 months, if there is a virus, that means the mom might have got from after birth, and this may have breast milk given, or it may be got from outside source. There are so many possibilities that will tell the baby got infected later on. So you can precise the treatment based on what you needed. That's the purpose mainly, but people are doing for everything. So I don't recommend to follow this one, but you have to see what you needed really. So this is the number one is ELISA. Okay. So when you do ELISA for IgG, IgM, when you do ELISA, what the advantages? Feasible. There's no viral exposure. It won't show acute infection. This might be showing sometime happened before. And then low sensitivity. The sensitivity is the problem issue with the ELISA. You need a lot of samples with so everyone you do ELISA. When you do ELISA, you need 50 microliter, 100 microliter. Sometimes you don't know what kind of dilution you have, samples, and all those complications come. When compared